Swine flu is a zoonotic disease, so it's a virus which circulates in pigs. It's virus which we see in population of pigs all across the world, and sometimes this virus can jump from animals to humans. It happens not that often, but it can happen. Normally, it results in a disease which is mild, and most of the people fully recover. But if we see this jump, we obviously need to monitor that, because in 2009 we've seen pandemic of swine flu, which was was mixture of three different viruses. So it was swine flu, which also have genetic material from bird flu and human virus. And in these cases, these can happen. This can cause pandemics. But at the moment, the virus which we observe is virus which is very closely related to the one which we observe in pig population. It's not really a new strain, because that's a strain which we observe in pigs usually, but we haven't seen it in humans in the UK over the last 20 years. And we also don't know if this virus jumped from animals to this person, or it was transmission between humans. In the second case, it is more alarming, because that means that this virus might have adapted to be spread in human population, but it doesn't mean that's the case. So it's very good that we found this case. It was found during routine visit, but we shouldn't be alarmed, because in case of these viruses, zoonotic viruses, so viruses found in animals, normally, even if they will cross this species barrier and will jump to animals, it doesn't mean that they are able to then infect more people. At the moment, the contacts of the person who got infected are searched and also monitored if they will have any symptoms of the disease. But as far as we know, nothing like that happened. Officials also are trying to trace where this infection came from. The person who got infected didn't say that, or at least that was reported, that they didn't have any contact with pigs. But it's also hard to say sometimes where the infection came from. Hopefully, we will find this trace, but it's hard to say. The symptoms are very similar to standard flu, and it can differ between severe disease to moderate disease to very light symptoms as well. So it is upper respiratory disease. So we have cough, we can have fatigue, higher fever, higher temperature, as well as it can start with sore muscles. So that can be something which we might look for, but these symptoms don't differ from standard flu. Obviously, it will depend from different pathogens, so different viruses, different bacteria. In case of flu, we were monitoring flu for years right now. We know a lot about this pathogen, and we dealt before with pandemics like this swine flu pandemic in 2009. So we have some experience with that, plus we have vaccines, and for years now, which can protect older people and people who can be more in danger of getting severe disease. So it's hard to say like overall if we are better prepared for a pandemic. It depends on a pathogen. But I think that also SARS-CoV-2 and COVID-19 shown us that it is very important to monitor these things and report that. So hopefully, yes, we learn something from that, and that we notice this single case there, and right now it is a very well, hopefully it is the trace of the infection, and as well as contacts of this person are searched for, means that it is taken seriously. So I think that at the moment that's everything what we can do with it.